Thank you for your interest in Ondos. This short video outlines the sampling instructions for the 5FU dose optimization test. Collecting a sample for Ondos. There are 5 main steps to correctly collect a sample for Ondos, so please take care to follow these step-by-step instructions exactly as presented here. Following these instructions will avoid delays in the testing process and ensure specimen integrity. Step 1. Filling out the test request form, or TRF. Fill out the Ondos test request form and applicable insurance paperwork. Complete the specimen collection date at the top center of the TRF. Then, fill in the patient and ordering physician information. Make sure to include an office contact name and phone number for any questions regarding the Ondos sampling or TRF. Also, make sure to complete with ordered 5FU dose in milligrams per meter squared and total infusion duration. Following completion of the sample collection, return to the TRF and confirm that the following 4 items have been performed. 1. That the single blood sample was drawn in accordance with the corresponding pump type. 2. That the pump must have been connected and infusing at full rate at the time of the blood draw. 3. That there was no evidence of line occlusion within 1 hour prior to the blood draw. And 4. That the blood sample was drawn from a peripheral vein and not the infusion port. Once you have confirmed these items are in accordance to the Ondos parameters, please sign the TRF. Step 2. Preparing the Ondos stabilizer and transfer device. Now, remove the Ondos stabilizer syringe from its outer foil package and the BD transfer device from its sterile package. Then, unscrew the cap of the supplied Ondos stabilizer syringe. Connect the BD transfer device and set the combined unit aside. Step 3. Correctly drawing the blood sample. It is very important for the accuracy of the Ondos test that the blood sample be drawn while the patient is at steady state during the 5FU infusion. Internal studies of pump dynamics have revealed differences in flow rates based on the type of pump used during the patient's continuous infusion of 5FU. These data indicate that optimal results are obtained when blood samples are drawn within the time periods specific to the pump type used. Therefore, according to the patient's pump type, draw peripheral venous blood into the supplied 6 milliliter K2 EDTA vacutainer tube. A port draw is unacceptable. If using a battery-operated pump such as Gemstar, CAD, or WalkMed for FOLFOX6, FOLFOX4, and Full Fury therapies, please ensure the patient is at steady state by drawing the Ondos sample between 18 hours after the start of continuous infusion up to 3 hours prior to planned completion. With FOLFOX4, draw the sample between 18 to 19 hours on day 1 or day 2. If using a non-battery-operated pump, for example, gravity or balloon types, for FOLFOX6 and Full Fury therapies, please ensure the patient is at steady state by drawing the sample between 18 hours after the start of continuous infusion up to 10 hours prior to the planned completion. Please do not use the Ondos test for patients receiving a FOLFOX4 split infusion therapy with a non-battery-operated pump. Also, it is very important to note that you should not draw the Ondos sample if any of the following occur. The 5FU infusion has been interrupted or augmented prior to the blood draw, for example, hydration. If the IV tubing has been occluded any time within 1 hour prior to the blood draw. Or lastly, if the pump is empty or no longer infusing. Step 4. Stabilizing the sample. Once you have drawn the blood sample correctly, connect the combined on-dose stabilizer unit over the K2 EDTA tube by firmly inserting the device through the tube stopper. Completely depress the on-dose stabilizer syringe to dispense into the tube. Once this is completed, mix sample by gently inverting at least 3 times. Shaking the K2 EDTA tube will cause hemolysis and may render the sample unusable. Now, label the K2 EDTA tube with its appropriate patient identifiers, for example, patient name and date of birth. Then centrifuge the sample at 1,500 to 2,000 G times 10 minutes. While the blood is in the centrifuge, it may be a good time to return to the TRF and confirm that the steps you have just taken were correctly performed. Fill in the relevant blanks and sign the bottom of the form. Step 5. Drawing the plasma. After removing the sample from the centrifuge, it is time to draw the plasma. In this step, it is important to make sure that you draw no more than half of the plasma with a supplied disposable pipette. Drawing more than half of the plasma or tracking down too quickly may jeopardize sample integrity. To correctly draw the plasma, first squeeze the bulb at the top of the pipette. Then insert the pipette tip just beneath the top of the clear plasma layer and slowly release the bulb. Track down smoothly as the plasma is being drawn into the pipette. Make sure to collect no more than half of the clear plasma layer. Aspirate only once to avoid disturbing the buffy coat or cellular layer of cells between the plasma and red blood cells. When you have drawn enough plasma into the pipette, transfer the sample into the supplied 3 milliliter cryovial tube. Then mark the provided barcode label with the patient's name and date of birth. The barcode is located at the top right of the on-dose test request form. Now attach the barcode lengthwise on the plasma tube. It is important that you carefully draw and transfer the plasma per the instructions in this step to ensure sample integrity. Let's summarize the key points for on-dose sample collection. 1. The patient must be at steady state when the sample is taken. There should not be any interruption to the 5-FU infusion before the sample is taken. 2. The sample must be drawn from a peripheral vein. 3. Please label the tube with 2 patient identifiers. 4. The stabilizer should be added immediately after the blood draw. 5. Hemolyzed samples will not be accepted. Please redraw the patient if gross hemolysis is noted after centrifugation. You have now successfully collected a sample for on-dose and it's ready to be sent to Myriad for analysis. Packaging and shipping. Now that you're done with the collection, there are 3 simple steps to follow to make sure that the specimen reaches Myriad without being compromised. Step 1. Place the labeled 3 milliliter cryovial tube in the supplied small clear Ziploc bag containing the absorbent strip. Place the clear bag and sample into the supplied red-topped 50 milliliter tube. Then place the red-top 50 milliliter tube in the supplied red specimen bag. Step 2. Place the completed on-dose TRF and insurance paperwork in the white on-dose envelope. Then insert the envelope into the outer pocket of the red specimen bag. If insurance is to be billed, include the following: a copy of both sides of the patient's insurance cards, the patient's signature on the on-dose TRF and applicable insurance-specific forms. For example, a signed Medicare Advance Beneficiary Notice of Non-Coverage. Step 3. Send the prepaid FedEx Clinical Pack to Myriad. The address is provided on the FedEx air bill. If you do not have a scheduled FedEx pickup, call 1-800-GO-FedEx. Receiving your on-dose results. Once the sample is received and processed at Myriad, an individualized report is generated, and the results are returned usually within 7 days, in time to make therapeutic adjustments for the next cycle of treatment. Please refer to the on-dose results guide on how to interpret the results. Remember, on-dose test results are used to help guide an individualized dose for subsequent cycles of 5-FU chemotherapy. After achieving target AUC levels, monitor the patient as necessary to maintain the target AUC. Thank you for watching this instructional video for on-dose sampling. If you have any questions regarding these procedures, please contact Myriad Medical Services at 800-469-7423, extension 3701, or email ondose@myriad.com. For further information, visit www.ondose.com.